Hello, I'm Dr. Robert LaBelle. Welcome to Education at CCSR. In this video we're going to be talking about tendons and the health of your tendons. Tendons are something we treat a lot at CCSR, and very often tendons are one of the major sources of pain in the human body. A lot of people talk about arthritis, but as we've seen in the research as of late, tendons are probably one of the biggest causes of pain, and especially something we treat at CCSR, take very seriously. There's a progression of tendon disorders that we see in clinic. Very often, a normal tendon is something that doesn't hurt. The patient basically feels no pain. And as time goes on, if the tendons become overloaded due to poor biomechanics, patients will end up getting a tendonitis. Tendonitis is felt as basically quite a bit of discomfort during activity. So if you had a tennis elbow tendonitis, if you're playing a racket sport, immediately during playing that racket sport you would feel elbow pain. If you had it in your knee, immediately while running you would feel knee pain. So tendonitis is a condition that we very often will see, and our treatment for a tendonitis is something in sports medicine that we call PRICE. Pressure, rest, ice, compression, and potentially elevation. Tendonitis is a short-term inflammatory process that occurs to the tendon where the tendon simply needs to calm down through rest and icing and potentially anti-inflammatories. As well, an assessment biomechanically of the area will help give you an idea if there's some degree of biomechanical disturbances such as muscle tightness, weakness, or joint tightness that's leading to the tendonitis. If the tendonitis goes on too long, and this is something we see a lot of, typically the measure of that is 3 to 4 months, we can end up getting a condition that's relatively new in the sports medicine world called tendonosis. We're not splitting terms here. The itis is representative of inflammation, and the osis is much more substantial. It talks about the tendon going through a degenerative process. Tendons that have been inflamed for a long time, the inflammation starts to wear away the tendon. It starts to create holes in the tendons, little micro tears, and tendonitis represents a little bit differently than tendonitis. A tendonosis patient will very often have a little bit of discomfort at the beginning of the activity, and then that tendon, if it's the Achilles or the knee tendon, will feel okay during the activity, and then the tendon might ache that night. So represents a little bit differently and doesn't really restrict your function like a tendonitis does. Tendinosis, like I talked about, very often have little micro tears, and this is where the danger of a tendinosis is, and it's one of the reasons why we have to take it seriously. If the little micro tears are occurring in the damaged tendon, sooner or later those invariably will become bigger tears, and this is the progression of the tendon. Normal tendon will turn into the tendonitis. If it goes on too long, we'll get the tendinosis, and then you can get a gross tear. This is stuff that becomes very hard to fix and very often requires surgery. So we want to prevent the progression of a tendinosis into a tear. Treating tendinosis is at times a lengthy project because what you're doing is you're doing active release, Graston, you're teaching home therapy stretches, eccentric strength training, and ball work to help regenerate and stimulate new growth of collagen, thus building up the damaged tendon and returning it to a normal tendon. Throughout that process, you're assessing the biomechanics of the patient as to why that tendon is loaded to begin with. A good thorough treatment, which usually would be once or twice a week in office, and quite a substantial home therapy program of probably close to 20 minutes a night, should help repair the majority of tendons from a tendinosis, leading them back into a healthy tendon. What we're looking at here is a healthy tendon on top, and what you can see is properly linearly arranged collagen fibers. They all run in one wavelength, and this proper linear arrangement allows the tissue to contract and expand properly. If you end up developing a tendonitis and eventually tendinosis, the bottom picture represents the tendinosis. The tendons in this picture are disorganized. There's little micro tears in the tissue. There's actually holes in the tissue. This tissue is very, very weak, and ultimately this is the tissue that will end up resulting in a tear.